So with respect to the event-free survival piece, that is going to include all high-grade recurrences, progression events, cystectomy events, deaths, metastatic disease. It's essentially a composite outcome that includes all of these different possibilities that could happen to a patient. And so in terms of how I envision these results influencing the current paradigm, well, I mean, I think if there's a similar excellent response rate in Cohort P as we've observed in Cohort P, um, yes, we won't know the counterfactual outcome, so we won't know the average treatment effects, but we'll have fairly good insight into efficacy, I think, if we still see a pretty good response rate with the good durability that we've seen in Cohort C. And I think should Cretostimogene become commercially available, I think it would be an option for patients to choose, even if they don't have CIS, potentially based upon what Cohort P shows. So that's the outcome, and I think that's potentially how it could influence the current treatment paradigm. This is where I give CG a lot of credit. They have a very cogent plan here in terms of how they're generating data. So cohort, I don't think that the plan for development of Cretostimogene depends on the success of Cohort P. They've already achieved a fair amount of success with Cohort C. And then they have Pivot 6, which is a randomized phase 3 comparing Cretostimogene to observation in patients with intermediate risk. So from that trial, they're going to know average treatment effects of Cretostimogene. And that's going to be a really important data point for those of us who are kind of following this space. And then I think from there they have a Cohort 8 trial where they're looking at refining how the drug is given. The legacy trials, the drug was actually a little difficult to give. There was a 5-step process where you were given DDM and saline, and the whole process took a long time, and it was not ideal. But in Cohort P and in Pivot 6, there's a 2-step process, and it's a lot easier, a lot more streamlined. Cohort 8 is testing both of those. There's a BCG naive cohort, where they're randomizing patients to each of those two. So that'll be an important developmental piece as well. And then Cohort 8 is also studying BCG exposed. So you can see they're generating a lot of data in this space to kind of answer important questions that I think as a whole really doesn't depend on whether Cohort P is successful or not. But certainly if Cohort P is successful, then it would, I think, lend some evidence to those of us that are treating a lot of patients in this space for potential use in BCG-unresponsive papillary-only patients.